Hey, as we start this video, what I'm going to ask you to do is look to the person on your left and look to the person on your right. Okay, well, maybe you're all by yourself, but if you were in that setting, I'm here to tell you that one out of the three of you would have parasites. That's right, that is a fact, as a matter of fact. And it's something, that it's definitely not one of those scenarios where ignorance is bliss. When I was growing up, there was a question that was asked, what's worse than biting into an apple and after you bit into the apple, you see a worm in it? Well, the answer to that is after you bite an apple, you look and you see a half a worm in it. Think about it. Well, that's where we are today, and it's better to know the cold hard facts in this regards than to go ignorantly about your day thinking that it doesn't affect you or it can't happen. But the fact is that one out of every three Americans is housing a parasite. And even though those parasites can differ they are different in various ways, they are all real in that. So I'm safe in thinking that nobody wants any of these nasty, creepy, crawling things inside them, or heaven forbid, having multiple creepy, crawly things inside of them living off of their living off of you and everything you eat. So how do you know if you have any of these things within you? Well, I've got a list here that I've made up, and I want to read it off to you, and I want you to understand this. There's a disclaimer. I'm not here to say that you do have them or that you have to have all of these different symptoms in order to determine or validate or verify that you have a parasite in you. But these are some of the more common symptoms of that are experienced by individuals who do have parasites. And it's really a good list of indicators. If you are anemic, if you have an anemia, if you experience recurring like nausea, or if you have diarrhea that's episodic, not every day, but frequently, maybe once or twice or three times in a month. If you're experiencing continual weight loss without really trying to lose weight, if you have a recurring abdominal pain, you have a lack of appetite, you have general weakness, and you think about these things, a lack of appetite, general weakness, these parasites are eating, frankly, from the same table that you're eating from. If you're grinding your teeth in your sleep, if you have pain or aching in your muscles or in your joints, if you're never feeling satisfied even or full after you eat your meals, if you have skin irritation or an unexplained rash or hives or rosacea or eczema, if you experience fatigue and exhaustion, depression, or frequent feelings of apathy, if you have trouble falling asleep or you wake up multiple times through the night, if you have unexplained constipation, diarrhea, gas, or other symptoms of irritable bowels. If you've traveled internationally, I mean, that's what we used to go, that we used to be the gold standard, if you will, that we determined if people could possibly have parasites if they traveled internationally, or they're getting what's called traveler's diarrhea while they're abroad, or if you have a history of food poisoning and your digestion has never been the same since that event. Well, basically, those are good, very good indicators. If you have multiple ones that I went through, more than two or three of those that you're experiencing, and the fact is, basically, every one of us, we are all at risk. If you cook your own meat at home, if you have pets, doesn't matter if you have pets at home or if you've ever had food poisoning, you've probably had a run-in with one of these guys, or maybe multiple guys as well. So listen, what you need to do is you don't want to allow the parasite to go unchecked. You need to get yourself screened. I mean, again, we go back to the original statement I made. One out of every three Americans has a parasitic infestation. So how would you know? Well, again, you want to get checked. So if this is something that you're curious about and you want to know if perhaps you're harboring, if you've heard about yourself in the list that I say, oh yeah, that's me, and yeah, I experienced this and that. Well, look, we invite you to just contact our office. You can come in, we can check you out, and if you do have parasites, then there are steps that you can take to rid yourself of them. Very effective steps as well, I might say. So look, thank you so very much for allowing me to share this information with you. And if you are interested, please contact our office. And we're here to help you because our goal, as always, you hear me say, we're here to help you to enjoy the best performance of your life. And if you've got parasites, you're certainly not enjoying the best performance of your life. So thanks for letting me share this with you. Until the next video, and as always, God bless.